Hello everyone, this is Dr. Govind Rai Garg. In this video we will discuss about anti-cancer drugs. First of all, cancer. What is a cancer? You all know it is uncontrolled growth of cells. Normal cells also divide, cancer cells also divide. The difference is normal cells stop dividing after some divisions, but cancer cells forget that they have to stop. So cancer cells keep on dividing. So that lead to production of large number of cells, which can cause two major problems. One, if they continue to produce the function of that cell, there will be hyperfunction. Like in thyroid cancer, there may be hyperthyroidism or thyrotoxicosis. In tumors producing insulin, that means insulinoma, there may be hypoglycemia. So extra function may occur. And second, because large number of cells are present and space extra is not there, so that can lead to pressure symptoms. They will keep on pressing the normal structures, so these pressure symptoms can occur. So basic problem is extra cells, so we need to kill those cells. So anti-cancer drugs are targeted to kill those cells, and we can broadly divide them into two categories. One which are non-specific, also called as cytotoxic drugs. Cytotoxic, as the name says, they are toxic to cells, but they cannot differentiate which cells, so they can kill many cells. Second are called as targeted anti-cancer drugs. So here the drug is targeted against particular substance present on tumor cell. So we have found some target on the cancer cell, so that the drug will mainly act on those cells. So in this video we will mainly concentrate on cytotoxic drugs. Okay. Cytotoxic drug, as the name says, they are toxic to cells. So they can kill almost any cell. But we want to kill mainly cancer cell, not the normal human cells. But we cannot differentiate because tumor cells and cancer cells are quite similar. So that's why cytotoxic drugs are very, very toxic. They kill the normal cells also at many places, that lead to side effects. But we want to maintain little selectivity so that cancer cells have more likelihood of being killed as compared to a normal cell. So what is the most important property of cancer cells we discussed? Yes, they are rapidly dividing. So anti-cancer drugs or cytotoxic drugs, they are made in such a way that they kill the rapidly dividing cells more frequently. But the problem is, in the body, the cells which are dividing normally very rapidly, they have high chances of getting killed. And what are those cells? Yes, cells of bone marrow. There is constant production of RBC, WBC and platelets in the bone marrow. So anti-cancer drugs can kill those cells which can lead to bone marrow suppression. Second, cells of GIT are constantly replaced. So anti-cancer drugs can kill those cells which can lead to diarrhea. Third, cells of hair follicle constantly grow. We have to get cutting every month. So anti-cancer drug can kill those cells which can lead to alopecia. Plus, if you see, there is large number of tumor cells which are getting killed by the cytotoxic drugs. So when so many cells are killed, the substances which are present inside the cell will be liberated. So whatever purines or proteins etc. are present in the cell, they will be liberated. They will be metabolized to form xanthin, and xanthin will be metabolized with xanthin oxidase to form uric acid. So when plenty of cells are killed, plenty of uric acid will be produced. So that can result in hyperuricemia. So these are the four adverse effects which you need not remember that this drug will cause, this drug will cause, or this drug will cause. Whenever we say anti-cancer drug, these four are likely to be present. So almost all cytotoxic drugs, they cause four side effects, that is bone marrow suppression, alopecia, diarrhea and hyperuricemia. If a drug do not cause, then you need to remember. Otherwise, cytotoxic drugs are likely to cause these four side effects: bone marrow suppression, alopecia, diarrhea and hyperuricemia. Clear? Second thing, there is a term called as cell cycle. Cell undergoes various stages during division. Okay? These four main phases are G1 phase, S phase, G2 phase and M phase. In S phase there is synthesis, it is called synthetic phase, there is synthesis of DNA become double. Whereas in M phase there is mitosis, means cell divide in two parts, means DNA become half. So in S phase DNA doubles, in M phase DNA halves. Then what is the meaning of G? G means G1, G2. What is G? No, it is not growth. G means gap. So this is a gap given to DNA. That means in these phases neither DNA doubles nor becomes half. But the cell is not stationary. Cell is preparing for division. So other organelles are getting doubled. So in gap 1 some organelles get double, and in gap 2 rest of the organelles get double, so that by the end of G2 phase everything is double. In S phase DNA has become double, rest of the organelles have become double in G1 and G2. So at the end of G2 phase cell is ready for division, everything is double. Okay. Now why we are discussing like that is, some drugs which inhibit the formation of DNA, they will be effective in S phase only. So they are S phase specific. Similarly, if a drug inhibit the mitosis, it will be M phase specific. Clear? Now the drug which bind to DNA, they will act on which phase? Very good. Not only S phase, the drug which bind to DNA, it can act on any phase, because DNA is present in every phase. It is getting doubled in S phase but present in other phases also. So the drugs which are binding to DNA, they will be non-specific, they can work on any phase. Okay? So we have mainly three type of drugs based on cell cycle: S phase specific, which inhibit formation of DNA; M phase specific, which inhibit mitosis; and non-specific, which bind to DNA. So we'll discuss these drugs one by one, starting from the first group called as alkylating agents. So as the name tells, they will attach the alkyl group. So obviously where they will attach the alkyl group? On the DNA. So if we see, this is a double stranded DNA. This is another double stranded DNA. In the cell, we have plenty of DNA. We know there are 23 pairs of chromosomes, and every chromosome has plenty of DNAs. But these DNAs do not talk with each other. They keep on doing own work. They keep on doing their own work. They do not talk to each other. So one DNA is getting its work, second DNA is doing its work. They do not talk with each other. But when we attach the alkylating agent, when we give the alkylating agent, they attach the alkyl group to DNA. It attach the alkyl group to this DNA also. And now these two alkyl groups join. So dimers are produced. Normally DNA do not interact with each other. So when we give alkylating agents, they join the two DNA with the help of alkyl group. And dimers normally do not exist in the cell. Now one very important thing, when the replication occurs, when DNA become double, how much similar this DNA is to parent DNA? Exactly same. Remember, replication means it is replica. The question is, can anything be so perfect that there is no mistake? It is 100% similar. Obviously it cannot. When mistake can happen, then why the DNA is exactly same? Why it does not differ? The reason is, if there is any defective DNA, any slightly changed DNA, that will be destroyed by the enzymes in the cell. In the cell there is police already, we keep on watching for this. If any different DNA is produced, that will be destroyed. So when dimers are produced, the enzymes in the cell, they recognize them as foreign, they recognize them as different, so they will destroy the DNA. Now because all the DNA is in the form of dimers, whole of the DNA is destroyed, and that will lead to death of the cell. Okay? So the mechanism of action of alkylating agent is, they attach the alkyl group to DNA, that result in formation of dimers. Dimers normally do not exist, so the enzymes will kill those DNA. Clear? Now the question asked is, what is the most common site of alkylation? At which place the alkyl group is attached? It is N7 of guanine. Remember, in the DNA we have 4 nitrogen bases: adenine, guanine, cytosine, thymine. On the guanine, at the 7th position where nitrogen is present, most commonly the alkyl group is attached. Clear? Now, like all the anti-cancer drugs, these also have 4 side effects. That is bone marrow suppression, alopecia, diarrhea, and hyperuricemia. But alkylating agents have two extra side effects as a group. These are, number 5, they can cause sterility. Infertility can occur with alkylating agents. And number 6, they can lead to secondary cancers. Secondary cancer means we have given for the treatment of one cancer, they can result in some other cancer. So secondary leukemias and sterility, they are the important adverse effects of alkylating agent apart from the 4 which are common to every cytotoxic drug. Okay, now the drugs in this group you can remember from: if bus not present, take my cycle. If bus not present, take my cycle. If stand for I-phosphamide. Bus means bus sulfan, busulfan. N means nitrosoureas. Nitrosourea is a group of drugs. The drugs in this group include carmustine, lomustine, and C-mustine. And sometimes they are written in the abbreviated form like Bucnu, Cacnu, and methyl Cacnu. Then P for procarbazine. T for temozolomide. M for melphalan, and C for cyclophosphamide. Cycle for cyclophosphamide. So if a bus not present, take my cycle. All of them are alkylating agents. All of them can cause 6 side effects: bone marrow suppression, alopecia, diarrhea, and hyperuricemia like every drug, and 2 special side effects: secondary leukemia and sterility. Now special points about individual drugs. The first and the last drug, I-phosphamide and cyclophosphamide. I-phosphamide and cyclophosphamide, they are metabolized to produce a compound called as acrolein. And this acrolein, it is very toxic to urinary bladder. It is filtered by the kidney, then it comes in the urinary bladder, and there it leads to inflammation. Inflammation of urinary bladder is known as cystitis. So it can cause cystitis, and many times the inflammation is so severe that it leads to bleeding. It leads to hematuria. So this cystitis is known as hemorrhagic cystitis. So 2 anti-cancer drugs which cause hemorrhagic cystitis are I-phosphamide and cyclophosphamide. And important to remember, I-phosphamide has higher chances of causing cystitis. Cyclophosphamide, only high doses cause cystitis, whereas I-phosphamide, any dose can cause cystitis. Now how to prevent this hemorrhagic cystitis? First, this hemorrhagic cystitis can be prevented by a substance called as mesna. The full form is mercapto. M is mercaptoethane sulfonic acid. Mercaptoethane sulfonic acid, also called mesna. It is used to prevent hemorrhagic cystitis. And mesna is always given with I-phosphamide, but it is combined only when we give high dose of cyclophosphamide. Okay? Second thing, if hemorrhagic cystitis has already happened, then which substance can treat this? This is to prevent. If we want to treat, then we need to give steroids. So steroids are given for treatment of hemorrhagic cystitis. Mesna is given to prevent hemorrhagic cystitis. So this is very important MCQ, hemorrhagic cystitis. So 3 important questions to remember. Number 1, which drugs cause hemorrhagic cystitis? I-phosphamide and cyclophosphamide. I-phosphamide higher incidence. Second, which substance is used to prevent hemorrhagic cystitis? It is mesna. Which substance is used to treat hemorrhagic cystitis? It is steroids. And which compound is responsible for hemorrhagic cystitis? It is acrolein. Okay, so this is important about I-phosphamide. Then coming to second drug, busulfan. The special point to remember, busulfan, the name contains LF. LF means lung fibrosis. So busulfan can cause pulmonary fibrosis as a side effect, and you need to remember important drugs causing pulmonary fibrosis. The drugs causing pulmonary fibrosis you can remember from the vehicles. These are some vehicles names, like we have cyclophosphamide. They contain cycle in the name. Busulfan, we just discussed busulfan. Then we have methotrexate. We have carmustine. We have amiodarone, and we have bleomycin. The important drugs which can cause pulmonary fibrosis, if you see the name contains cycle here, bus here, methotrexate, truck here, carmustine, amiodarone contains a drone. So bus, cycle, car, truck, and all of them blow the horn. Bleomycin means blow the horn. So all these drugs can cause pulmonary fibrosis. Okay. Then moving to next group, nitrosourea. Nitrosourea is a group of drugs. The drug name end with mustine, like carmustine, C-mustine, low-mustine, and sometimes abbreviations are written like Bacnu, Cacnu, Methyl Cacnu. So Bacnu means BCNU. It stands for the full name of this drug, carmustine. Full name like bis-nitroethyl cyclomethyl nitrosourea. So you don't need to remember the full name. Many times in the options they give the abbreviation. So if any abbreviation end with NU, that stand for nitrosourea. Okay. The special point about nitrosoureas are used for brain tumors. Nitrosoureas, they are used in brain tumors like gliomas. Used for brain tumors. And second important thing is nitrosoureas, they can cause delayed bone marrow suppression. What is the meaning of this is, we discussed any anti-cancer drug can cause bone marrow suppression. So commonly what we do, we start the anti-cancer therapy and then periodically almost every week we keep on measuring the blood counts. So blood counts, whenever they start decreasing, they usually start decreasing in a week or so with most anti-cancer drugs. But in nitrosoureas, when we start nitrosourea and measure the blood counts after 1 or 2 weeks, they will appear normal, but later on they will tend to fall this. So they cause delayed bone marrow suppression or delayed neutropenia. Okay. Next drug is procarbazine. Procarbazine can lead to disulfiram like reaction, intolerance to alcohol. Temozolomide is used in brain tumors like gliomas. Then cyclophosphamide we already discussed. It can cause hemorrhagic cystitis. Clear? So these are the important points regarding the first group of cytotoxic drugs, alkylating agents. Okay. Now moving to second group of drugs called as platinum compounds. The drugs like cisplatin, the name end with platin, carboplatin, and oxaliplatin, the name end with platin. Now these drugs are exactly similar to alkylating agents in mechanism of action. That means like alkylating agents, they attach the two DNAs, form the dimers. Then this dimers is normally do not exist, so DNA enzymes will destroy this DNA. When everything is same, then why we have created the second group? Because by definition alkylating agents will attach the alkyl group, whereas these attach the platinum group. Everything else is same. The binding site is also same, that means these also bind to N7 of guanine. Everything is same means these also have 2 extra side effects. Like all the drugs, they cause 4 side effects: bone marrow suppression, alopecia, diarrhea, hyperuricemia. But like alkylating agents, they also cause 2 extra side effects: sterility and secondary leukemia. Clear? Now the special points, this drug cisplatin has 3 more side effects. These are, cisplatin can cause vomiting, Cisplatin is nephrotoxic and cisplatin is ototoxic. Now almost any drug can cause vomiting. So what is special is, among the anti-cancer drug, the highest risk of vomiting is with cisplatin. It is most emetogenic anti-cancer drug. Now how to treat anti-cancer drug induced vomiting? Most of the anti-cancer drugs, they cause early vomiting, means vomiting occurs within first 24 hours. But cisplatin, sometimes it causes delayed vomiting. That means vomiting can occur after 24 hours. The drug of choice for early vomiting with all anti-cancer drugs, the drug of choice is ondansetron group of drugs. Ondansetron group of drugs, that means 5-HT3 antagonists, they are drug of choice for early vomiting. But ondansetron is not effective in delayed vomiting. The drug of choice for delayed vomiting is aprepitant group of drugs. These are substance P antagonists. They are drug of choice for delayed vomiting. Aprepitant, any drug ending with pitant, is substance P antagonist. These are drug of choice for delayed vomiting. So early vomiting ondansetron, delayed vomiting aprepitant, and if they do not mention early or late, we will assume it early because most of the time it is early vomiting. So answer should be ondansetron group of drugs. Any drug ending with setron. Okay. So that is about vomiting. Cisplatin is most emetogenic anti-cancer drug. Then it can cause nephrotoxicity and ototoxicity. Nephrotoxicity is reversible, whereas ototoxicity is irreversible. And nephrotoxicity of cisplatin can be easily prevented. And how to prevent nephrotoxicity due to cisplatin is, one, it should always be given as slow IV infusion. If we give it rapidly, more risk of nephrotoxicity, so always given slow. Second, before given cisplatin, we give around 2 to 3 liters of normal saline to a person. That is called as saline loading. Basically, we have loaded the kidney with saline. Now when we give cisplatin, it go to kidney, it will get diluted and there is lesser risk of nephrotoxicity. And third, one drug can be used which is called amifostin. So amifostin, it can be used to prevent nephrotoxicity. Second important use of amifostin is it can be used to prevent xerostomia due to radiation. It can prevent radiation induced dry mouth. So it is a radio protector also. So these are the important points regarding the cisplatin. Then oxaliplatin. Oxaliplatin is used in colorectal cancer. It is used in colorectal carcinoma. Oxaliplatin. In colorectal carcinoma, actually two type of regimes are indicated. One is called as FOLFOX and second is called as FOLFIRI. FOLFOX, the FOL in both the cases, it stands for folinic acid. Folinic acid. Then second F also in both the cases, it stands for fluorouracil, 5-fluorouracil. So two drugs are common in both the regimes, folinic acid and fluorouracil. Then this regime contains ox means oxaliplatin, which we were just discussing, or in second regime it is iri means irinotecan. So oxaliplatin or irinotecan with folinic acid and fluorouracil. These are the regimes for colorectal carcinoma. Clear? So this is about the second group of cytotoxic drugs which are platinum compounds. Then moving to third group, which are called antimetabolites. Before going to antimetabolites, tell me on which phase of cell cycle alkylating agents or platinum compounds work. On which phase of cell cycle? Yes, they will work on all the phases because they are binding to DNA and DNA is present in all the phases. So the first two groups, they are non-specific. They can work on any phase of cell cycle. But anti-metabolite, as the name tells, they will inhibit the metabolism. And metabolism, obviously, most importantly, it should be related to DNA synthesis. So that means if a drug is inhibiting the formation of DNA, on which phase it will work? We already discussed, yes, S phase. So all the anti-metabolites, they are S phase specific. They work on S phase of cell cycle. Okay? And we have three important type of drugs which act on metabolism. One which inhibit purine synthesis. Second which inhibit pyrimidine synthesis. And third which act on folic acid. So the drugs acting on purines, drugs acting on pyrimidine, and drugs acting on folic acid. The drugs acting on purine, these include 6-mercaptopurine, 6-mercaptopurine and 6-thioguanine. 6-mercaptopurine and 6-thioguanine. They are purine analogs. So basically what happens is their structure is similar to purines. So DNA polymerase get confused and they pick up these drugs in place of purines. So DNA formation is stopped. So they work on S phase of cell cycle. Like all the anti-cancer drugs, they have 4 side effects, which are bone marrow suppression, alopecia, diarrhea and hyperuricemia. Okay. Now apart from these 2 drugs, we have another drugs like cladribine and fludarabine also. The special MCQs to remember about these drugs: first 2 drugs, mercaptopurine and thioguanine, they are hepatotoxic. They can cause liver damage. 6-mercaptopurine and 6-thioguanine can cause hepatotoxicity. Then this 6-mercaptopurine, it is metabolized by an enzyme called as xanthine oxidase. So xanthine oxidase will make it inactive, 6-mercaptopurine. And xanthine oxidase is the same enzyme which converts xanthine to uric acid. So xanthine oxidase is not only forming the uric acid, but it is also breaking 6-mercaptopurine. We discussed all anti-cancer drugs can cause hyperuricemia. So we will not want the hyperuricemia. So along with anti-cancer drugs, we give xanthine oxidase inhibitor like allopurinol, so that uric acid is not produced to prevent hyperuricemia. But suppose we give 6-mercaptopurine for cancer and with that we give allopurinol to prevent hyperuricemia, what will happen? Allopurinol will inhibit xanthine oxidase, so that means it will inhibit the metabolism of mercaptopurine also. And when mercaptopurine is not metabolized, it will become toxic. So there is high risk of bone marrow suppression. Then what is the solution? The simple solution is reduce the dose of mercaptopurine. So whenever allopurinol is given along with mercaptopurine, the dose of mercaptopurine should be reduced. It is usually made 1/4 of the original dose. Okay, so that is important about mercaptopurine. Then cladribine, it is a drug of choice for hairy cell leukemia. For hairy cell leukemia, cladribine is drug of choice, whereas fludarabine is drug of choice for chronic lymphoid leukemia. For chronic lymphoid leukemia, fludarabine is drug of choice. For hairy cell leukemia, cladribine is a drug of choice. Clear? Now moving to drugs similar to pyrimidines. So drugs similar to pyrimidines, these include 5-fluorouracil, capecitabine, gemcitabine and cytarabine. 5-fluorouracil, capecitabine, gemcitabine and cytarabine. Like all the anti-cancer drugs, they also cause 4 side effects: bone marrow suppression, alopecia, diarrhea, hyperuricemia. The special point to remember, the first 2 drugs, 5-fluorouracil and capecitabine, they are also associated with hand and foot syndrome. Very important side effect. As the name tells, there will be redness and swelling of hand and feet. Hand and foot syndrome caused by 5-fluorouracil and capecitabine. And capecitabine can be given orally. It is actually a prodrug of 5-fluorouracil. Remember, 5-fluorouracil itself is a prodrug because it will be metabolized to form triphosphate. Then it will confuse the DNA polymerase. But 5-fluorouracil, capecitabine is metabolized from 5-fluorouracil, and then it will further metabolize and produce the action. Okay. Gemcitabine, it is a drug of choice for pancreatic carcinoma. Gemcitabine, drug of choice for pancreatic carcinoma. And cytarabine, you can remember, C for cerebellar side effect. Cytarabine can cause cerebellar side effect like ataxia, nystagmus, vertigo, etc. Clear? Now, one important thing, the question asked which of the following is anti-metabolite, or the other way of asking the question, which of the following drug work on S phase. From the name you can remember, their name should contain purine or pyrimidine in some form. Like we know, what are the normal purines in DNA? Yes, these are adenine and guanine. And what are pyrimidines in the DNA? We have cytosine and thymine. Now, if you get confused which is purine, which is pyrimidine, you can easily remember pyrimidine contains Y in the name. So, if the substance contains Y, it is pyrimidine. So, cytosine and thymine are pyrimidine. Adenine and guanine are purines. Now, if the drug name contain any of these, like mercaptopurine, it is containing purine. Thioguanine containing guanine, or fluorouracil containing substance. So, if the name contain purine or pyrimidine, these are antimetabolites. But if the name do not contain purine or pyrimidine, but the name ends with bin, capecitabine, cytarabine, gemcitabine, cladribine, fludarabine. So, bin means bina metabolism. So, here the drug will be bina metabolism, that means anti-metabolites. So, the drug name ending with purine or pyrimidine, or the drug name ending with bin, means they are anti-metabolites. They will work on S phase only. Okay. Now, moving to the last but very important group, folic acid. If you remember, three substances, pteridine, PABA and glutamate, they combine together to form folic acid. Folic acid is actually dihydrofolic acid. The enzyme is folic acid synthase. And this is the folic acid which we take in diet. So that means even if the cells do not produce, not much problem, the dietary folic acid can be utilized. But this folic acid is inactive. It must be converted to folinic acid. Folinic acid is tetrahydrofolic acid, which is the active form of folic acid, and it is converted by the enzyme dihydrofolic acid reductase. And this tetrahydrofolic acid help in formation of DNA. So that means if we stop this pathway, DNA production will stop. So the drug can be used as anti-cancer. And the drug we utilize is which inhibit dihydrofolic acid reductase. So dihydrofolic acid reductase, when we inhibit, folinic acid will not be produced, or the active form of folic acid cannot be produced. So DNA production will stop. And the major drug inhibiting this enzyme is methotrexate. Methotrexate. The special point to remember about methotrexate, it is drug of choice for two conditions. One, choriocarcinoma, and second, it is drug of choice for rheumatoid arthritis. It is not only anti-cancer but a powerful immunosuppressant drug also. It is used in rheumatoid arthritis. It is a disease modifying anti-rheumatoid drug of choice. But methotrexate has several other uses also, and the important uses of methotrexate you can remember from cancer. We know methotrexate is used for cancer. C for choriocarcinoma we already discussed. It is a drug of choice. A for acute leukemias. It is used for treatment of acute leukemias. And for non-Hodgkin's lymphoma. C for Crohn's disease as an immunosuppressant. E for ectopic pregnancy. We can use in ectopic pregnancy. And R for rheumatoid arthritis. So among these, first and last are must to remember because it is a drug of choice. Methotrexate is a drug of choice. Now coming to major side effects of methotrexate. Like all anti-cancer drug, it can cause 4 side effects: bone marrow suppression, alopecia, diarrhea, and hyperuricemia. But special point to remember, methotrexate is hepatotoxic. Hepatotoxic. It can cause liver damage, so LFT monitoring is recommended. And second, methotrexate, if you see the mechanism, it is inhibiting the folic acid pathway. So if there is a deficiency of folic acid, what can happen? Yes, megaloblastic anemia. So methotrexate can result in megaloblastic anemia. Clear? Suppose methotrexate toxicity occur, bone marrow suppression has occurred. So can you reverse the bone marrow suppression by giving folic acid in the diet? Remember, it is inhibiting the folic acid pathway. So can giving folic acid treat the methotrexate toxicity? The answer is no. Why? Because folic acid cannot be converted to folinic acid. The problem is folinic acid. It is not produced. So if we want to treat methotrexate toxicity, we need to give folinic acid. Folic acid will not work, and folinic acid is also called as tetrahydrofolic acid. Another name is leucovorin. And the third name is citrovorum. So folinic acid or leucovorin or citrovorum, they are used for treatment of methotrexate toxicity. Folic acid will not be effective. Okay. Then recently we have developed newer methotrexate like drugs. So newer dihydrofolic acid reductase inhibitors. These include pemetrexate and pralatrexate. So from the name you can remember, name is like methotrexate, pemetrexate, pralatrexate. Now pemetrexate, it is used for treatment of mesothelioma. Pemetrexate is used in mesothelioma. The name says ME for mesothelioma. Whereas pralatrexate is indicated in peripheral T cell lymphoma. Peripheral T cell lymphoma. Again, from the name you can remember, it is PR means peripheral, L means lymphoma, T cell. So pralatrexate contain peripheral lymphoma of T cell in the name. So these are the newer dihydrofolic acid reductase inhibitors. Basically, this is important about the anti-metabolites, and all the anti-metabolites including methotrexate and these drugs, they will be S phase specific. Okay. Then moving to next mechanism is drugs acting on mitotic spindle. Mitotic spindle inhibitors. First of all, we'll try to understand what is mitotic spindle and what does it do. At the end of G2 phase, before the M phase, everything has become double in the cell. DNA has also become double. So now we want to distribute everything equally in 2 daughter cells, and among them DNA must be exactly equal. So how to equally divide the DNA in 2 parts? So 2 places DNA should be present, then we can divide the cell from the center. So what happens? The centrioles which are present on the cell, they arrange at 2 different poles. Centrioles will arrange at 2 different poles, and over these centrioles there is formation of spindle. A spindle is produced over these centrioles. Now spindle is actually consisting of a protein called as a tubulin, and tubulin is very small in size, so that means tubulin is only this much. So if we want to form a complete spindle, so many molecules of tubulin should combine together. So formation of spindle is also called polymerization of tubulin. So many molecules of tubulin polymerize together to form spindle. So spindle is produced. Now the chromosomes, they will be arranged on the center of this spindle. So here the chromosomes are arranged. Chromosomes are arranged on the equatorial plane or the center of the spindle. So after the chromosomes are arranged, now these chromosomes, they break from the center. Chromosomes are broken from the center into 2 exactly equal parts. So chromosomes are broken from the center, but along with the chromosomes, the spindle also break. So tubulin also break, depolymerization occur. Okay, so the chromosomes break and spindle break. So when the chromosomes break and spindle break, they start going to two different poles. So half of the chromosomes they deposit at this place, half of the chromosome accumulate at this place. So now we have got two different places where same amount of chromosomes are present. Now the cell can divide from the center and two different cells with exactly same amount of DNA can be produced. Clear? In simple terms, if we see, if we want to divide the cell in two parts, we require first the spindle to form and then the spindle to break. So spindle must form first and then break. If we stop any of these two things, then the cell cannot divide. Okay? So we are targeting the anti-cancer drug for these mechanisms. So some drug will inhibit formation and some drugs will inhibit breakdown of spindle. Clear? And all of these drugs will act on which phase of cell cycle? Yes, they will be M phase specific. Okay. Now the drugs which inhibit formation of spindle and drugs which inhibit breakdown of spindle. Formation is inhibited by vincristine and vinblastine, whereas breakdown is inhibited by paclitaxel. So from the name you can remember, here the name start with bin. Bin means bina spindle. Spindle banega hi nahi. Whereas paclitaxel name start with pack, means after formation spindle is packed. And when it is packed, it cannot be broken. So paclitaxel inhibit breakdown of spindle. Vincristine and vinblastine inhibit formation of spindle. Clear? Now special thing to remember, vincristine is the first exception. Remember, not the group, only vincristine. It is the first exception. We discussed all anti-cancer drugs cause bone marrow suppression, but vincristine do not cause bone marrow suppression. It is called as marrow sparing drug or bone marrow sparing drug. It do not cause bone marrow suppression. All anti-cancer drugs cause bone marrow suppression. Vincristine do not cause. Clear? But this group, both vincristine and vinblastine, remember vinblastine cause bone marrow suppression, vincristine do not cause. Now this group, vinca alkaloids or vincristine and vinblastine, they have two special side effects, that is peripheral neuropathy and syndrome of inappropriate ADH secretion. Vincristine do not cause this bone marrow suppression, but vincristine as well as vinblastine, they can cause peripheral neuropathy and SIADH. Okay. On the other hand, paclitaxel, it is associated with severe hypersensitivity reaction. Hypersensitivity reaction can occur with paclitaxel. Okay. Now we have developed some newer drugs which can act on mitotic spindle, which are M phase specific, and these newer drugs include, we have eribulin, ixabepilone and astramustine. Now eribulin and ixabepilone both contain B in the name, so they are used for B means breast cancer. Eribulin and ixabepilone are indicated in breast cancer. Then second thing, eribulin, from the name you can remember, the name contains bule means tubule, so it inhibits tubulin. Tubulin is inhibited by eribulin. Whereas astramustine, although the name contains astra plus mustine, because it is a combination of estrogen with a mustine. Mustine means nitrosourea. But the mechanism of action do not involve any of these. The mechanism of action of this drug is to inhibit mitotic spindle, and this drug is used in prostate cancer. So this is important about the drugs acting on mitotic spindle. Okay. Then we have next group of drugs which are called topoisomerase inhibitors. Now if you remember, topoisomerase is an enzyme which help in uncoiling of DNA, just like DNA gyrase in bacteria. So this help in uncoiling of DNA or simply formation of DNA. And we have two type of topoisomerases, topoisomerase 1 and topoisomerase 2. So if we inhibit any of them, then DNA formation can be stopped. So we can use the drug as anticancer. The drug inhibiting topoisomerase 1 is irinotecan, and drug inhibiting topoisomerase 2 is etoposide and anthracyclines. Etoposide and anthracyclines. Again, from the name you can easily remember, I look like one. So irinotecan is topoisomerase 1 inhibitor, whereas the other drugs are topoisomerase 2 inhibitors. Now all these drugs, like all the drugs, cause 4 side effects: bone marrow suppression, alopecia, diarrhea and hyperuricemia. Special point to remember about irinotecan: irinotecan is used in colorectal cancer. Remember we discussed folfiri contains irinotecan, so colorectal cancer. And second, its side effects are cholinergic side effects. It has cholinergic side effects like diarrhea, sweating, all these side effects are present. Then coming to topoisomerase 2 inhibitor, etoposide, from the name you can remember it contains topo in the name. So it is a topoisomerase inhibitor. The name is not starting from I, that means it is not 1 inhibitor, it is 2 inhibitor, etoposide. Second thing, its name start with E. E means it cause early secondary leukemia. Remember we discussed alkylating agents and platinum compounds, they also cause secondary leukemia. Etoposide also cause secondary leukemia. But there is a difference. The difference is the secondary leukemia caused by etoposide, it occurs quite early. If we give alkylating agent, it causes secondary leukemia after several years, whereas it can cause in few months also. So secondary leukemia onset is early. Second difference is there is absence of myelodysplastic stage. Myelodysplastic stage is absent. What is the meaning is, suppose a person is started on alkylating agents, and if we keep on doing bone marrow biopsy for before the person develops secondary leukemia, there will be changes in the bone marrow. So myelodysplastic stage is noted. Whereas in case of etoposide, there will be no myelodysplastic stage preceding to leukemia, directly leukemia will occur. Okay? So you can remember the fact in this manner that they cause secondary leukemia, but they are in a hurry. इनको इतनी जल्दी है सेकेंडरी ल्यूकीमिया करने की कि ये कहते हैं कि माइलोडिस्प्लास्टिक स्टेज को छोड़ दो यार, इसको क्या करना है, सीधा ल्यूकीमिया करते हैं. So there is absence of myelodysplastic stage. Okay. Now coming to anthracyclines. Anthracycline is group, and the drugs in anthracycline group are doxorubicin and donorubicin. Doxorubicin and donorubicin are anthracyclines. Apart from the common side effects of bone marrow suppression, alopecia, diarrhea and hyperuricemia, these drugs doxorubicin and donorubicin, special side effect is they are cardiotoxic. They can damage the heart. They can cause congestive heart failure. They can cause arrhythmias. They can cause cardiomyopathies. So these are cardiotoxic, and that you can remember from the name. Their name start with the D. D means dil. In Hindi, D means dil, heart. So they are affecting the heart, and it is more easier to remember if you see the full name. The full name contains a ruby also. You can remember ruby dil le gayi. Doxorubicin, donorubicin, they are cardiotoxic. And we can prevent the cardiotoxicity. The reason of cardiotoxicity is they generate free radicals, and that free radicals may damage the heart. And if we remove those free radicals, there is less risk of cardiotoxicity. And the drug which can remove the free radicals is dexrazoxane. So dexrazoxane is a free radical squencher. It can be used to prevent the cardiotoxicity due to doxorubicin or donorubicin. Another important point regarding these drugs is they can cause radiation recall syndrome. Radiation recall syndrome means a person was given as a radiotherapy for treatment of some cancer. Suppose person has head and neck cancer, radiotherapy was given in this area. After that, the drug therapy was planned and the person is given doxorubicin like drug. Now, if a person is given doxorubicin like drug, there will be lesions on those areas where radiotherapy has previously been given. So there will be redness in this area. So you can find from the name itself, you can recall that radiotherapy has been given to this area. So it is called as a radiation recall syndrome. So doxorubicin like drugs are associated with radiation recall syndrome also. Okay. So this is about the topoisomerase inhibitors. Now moving to the remaining drugs, or we can say miscellaneous drugs. And the most important drug which is missing is bleomycin. Bleomycin. So as we discussed already, bleomycin. Bleomycin is a drug which is metabolized by an enzyme called as bleomycin hydrolase. Bleomycin hydrolase will make it inactive. Bleomycin hydrolase makes it inactive. And this enzyme is deficient at two places. One, it is deficient in the skin, and second, it is deficient in the lungs. So skin and lungs have lesser amount of bleomycin hydrolase. So these two areas, bleomycin will not be broken appropriately. So they are at high risk of developing the toxicity. The major toxicity of bleomycin on the skin is called as flagellated pigmentation of skin. So on the skin there will be linear streaks like flagella. So just like flagella, there will be streaks of pigmentation on the skin called as flagellated pigmentation. Whereas in the lungs it can cause pulmonary fibrosis. We already discussed its name contains blow. It will blow the horn. So pulmonary fibrosis can occur. Special point, bleomycin do not cause bone marrow suppression. So just like vincristine, it is a bone marrow sparing drug. Bleomycin is marrow sparing. So two marrow sparing drugs we have discussed so far. One was vincristine and second is bleomycin. Okay. Then the second important drug left is L-asparaginase. L-asparaginase, as the name says, it is asparagine ase. Ase means an enzyme. It is an enzyme which break asparagine. And we know asparagine is a amino acid. So when we break amino acid means proteins will not be formed. So the cells will die because of deficiency of proteins. So this is an anti-cancer drug which acts by inhibiting the protein synthesis. Clear? Now this is also a marrow sparing drug. So you need to remember only three marrow sparing drugs. One was vincristine, second is bleomycin, and third is asparaginase. It is a bone marrow sparing drug. It is mainly used for treatment of ALL. And from the name you can remember A for acute, L for lymphoid leukemia. So it is used for acute lymphoid leukemia. Remember the four options will be ALL, AML, CLL, CML. So do not get confused, used for acute lymphoid leukemia. The major side effect of asparaginase being, one, it can cause allergy, hypersensitivity reaction. It is an enzyme, so enzymes can cause hypersensitivity. And second, it can cause acute pancreatitis. The major side effect is acute pancreatitis. So apart from hypersensitivity reactions, asparaginase is associated with acute pancreatitis. Okay. Then we have a drug called as arsenic trioxide. Arsenic trioxide. It is indicated in acute promyelocytic leukemia, which is M3 stage of AML. Acute promyelocytic leukemia. First question is, how a patient of leukemia present? Yes, the patient present with repeated infections. But the question is, leukemia is a tumor of WBCs, and WBCs fight against infection. So when WBCs are more, infection should be less. Then why infection is more? The reason is WBCs are not more. It is the immature form of WBCs which are more. So acute promyelocytic leukemia, promyelocytes are more. WBCs are lesser. So WBCs cannot become mature, maturation do not occur. Pro-myelocyte stage, the maturation is hindered, it is stopped. So this is just similar to a situation in which there is plenty of babies at home, lot of children, but no adult. So when adult is not there, no work can be done. So same here, infections occur. So if we mature the pro-myelocyte to become leukocytes, then this problem will be solved. So that is done by arsenic trioxide. So arsenic trioxide, it acts as a maturation agent. It helps in maturation of pro-myelocyte to leukocytes. Okay. Then the last drug we can discuss is thalidomide. We all know thalidomide was used for morning sickness long ago, but it was withdrawn because of teratogenicity. It was causing phocomelia, so it was withdrawn. But now thalidomide is being used for treatment of multiple myeloma. Thalidomide is an anti-cancer drug. It can treat multiple myeloma. The major mechanism in multiple myeloma is it is angiogenesis inhibitor. It acts by inhibiting angiogenesis. But thalidomide is a very powerful immunosuppressant drug also. It can inhibit TNF alpha. Powerful immunosuppressant drug, so can be used for lot of autoimmune conditions also. Okay? So apart from multiple myeloma, it is used for many immunosuppressive conditions where we want to produce immunosuppression. The two major side effects of thalidomide you need to remember. One, it can cause constipation. Second, it can cause peripheral neuropathy. Now, why we are discussing these 2 points specifically? It has many more side effects, but these two will answer most of our MCQs. The first question asked on thalidomide is, all of the following are adverse effect of thalidomide except. Remember, most anti-cancer drugs cause diarrhea, but thalidomide cause constipation. So, if diarrhea is written, that is the answer. Second, thalidomide has plenty of uses we discussed. Thalidomide has plenty of uses, many immunosuppressant conditions we want to produce, we can use. But MCQ asked all of the following are potential users, or we can say all of the following users we can use thalidomide except. So thalidomide can be used for lot of conditions, but answer to that question is almost always peripheral neuropathy. Remember, it causes peripheral neuropathy, do not treat peripheral neuropathy. Clear? So these are the important points regarding the thalidomide also. That means we have completed the topic of cytotoxic anti-cancer drugs. But one question which is very frequently asked on these drugs is regarding their specific side effects. Remember, all can cause bone marrow suppression, alopecia, diarrhea, hyperuricemia, but specific side effects. So how to remember those specific side effects? We'll try to remember them by making a cartoon. So this is a cartoon, a fat cartoon. This cartoon has worn a cap. These are the ears of the cartoon. This is the smiling face of the cartoon. Then because we are talking medical terms, so we'll make little organs here. So like it has lungs here, lungs present here. We have heart here. Then we have liver present here. Then we have kidneys here. And then we have urinary bladder also. Now how to remember? How to remember the adverse effects? If you see the ear look like C. Ear look like C. So C stand for cisplatin. C stand for cisplatin. And cisplatin can affect the ears. That means it is ototoxic. Cisplatin is ototoxic. Now if you see the kidney also look like C. Kidney also look like C. So cisplatin is a nephrotoxic also. And if you see the smiling face also look like C. So cisplatin can cause vomiting also. So cisplatin is nephrotoxic, it is ototoxic, and it is most emetogenic anti-cancer drug. So you can remember that. Then if you see these limbs, they look like V. So V stand for vincristine or vinblastine. Vincristine and vinblastine. So it is present in the periphery. So it causes peripheral neuropathy. So vincristine, vinblastine cause peripheral neuropathy. And you see this cap also look like V. So that means they affect the brain also. So what they do? They release ADH from the posterior pituitary and hypothalamus. So that lead to SIADH. So vincristine and vinblastine, they cause peripheral neuropathy and syndrome of inappropriate ADH secretion. Okay. Then if you see these lungs, they look like B. Lungs look like B. So B stand for busulfan and bleomycin. So busulfan and bleomycin, they can cause pulmonary fibrosis, and this we already remembered. They contain vehicles in the name. Busulfan, bleomycin means blow the horn. They can cause pulmonary fibrosis. Then if you see the heart look like D, So D stand for doxorubicin and daunorubicin. Doxorubicin and daunorubicin. And this also we have already remembered. D means दिल, ये दिल को affect करते हैं. रूबी, so रूबी दिल ले जाती है. So doxorubicin and daunorubicin are cardiotoxic. Then if you see this liver look like a figure of 6. Liver look like a figure of 6. That means the drug starting from 6 mercaptopurine and 6 thioguanine, they affect the liver. So 6 mercaptopurine and 6 thioguanine are hepatotoxic. Okay? And if you see, only complete cycle in this is cycle of bladder. This bladder cycle is the cycle which is complete. So cycle means cyclophosphamide. So it affect the bladder, means it cause hemorrhagic cystitis. So cyclophosphamide cause hemorrhagic cystitis. So these are the important methods to remember the adverse effect, or we can say specific adverse effect of anti-cancer drugs. Okay, thank you very much.